Hey everyone, welcome back. We're diving deep today, going right into the heart of a really serious issue in the US, the opioid epidemic.
It's a big one for sure.
Yeah, it is. We've got some excerpts from the opioid epidemic, a nation in crisis, and we're going to
Yeah.
use those to really try to see beyond just the headlines, right?
Absolutely. It's about understanding how we got here.
Exactly. And it's about the people too. It's not
Mhm.
just numbers and statistics. It's about understanding the real human cost and looking for hopefully some paths forward. So where do we even begin? I mean, this is such a huge multifaceted problem.
Well, the source calls it a perfect storm, actually. It's like all these different factors came together at just the wrong
A
time.
perfect storm, huh? Okay,
Good.
so what were the biggest factors? What really fueled this crisis?
One thing that really jumped out at me from the source was the role of pharmaceutical companies.
Oh yeah.
They weren't just, putting out ads. They were like funding research that downplayed how addictive these drugs were, sending salespeople to doctors with, frankly, misleading information. All of that led to way too many opioid prescriptions being written.
That's kind of like, they were setting the stage for this whole crisis, right?
It really does seem that way, yeah. The source even said that back in the 90s, these companies spent over $40 million lobbying doctors and politicians.
Wow. $40 million. That's just mind-boggling.
Yeah, it is. And all of those pills, they created this huge pool of people who became addicted. And as that happened, a lot of them turned to cheaper, even stronger drugs to get their fix.
Like heroin.
Exactly. And
Yeah.
and even more dangerous.
Fentanyl.
Yeah, fentanyl. The source really, really emphasizes how deadly it is. I mean, what makes it so much more dangerous?
Well, it's incredibly potent. It's like up to 100 times stronger than morphine. Even a tiny, tiny amount can kill you.
That's scary. It is. And what makes it even worse is, it's often mixed into other drugs without people knowing. So they think they're taking one thing and it's actually laced with fentanyl.
Wow, so you literally don't know what you're getting. It's
Yeah.
it's like playing Russian roulette.
Right.
The source also talks about social and economic problems, like poverty being part of this. How do those things fit into the opioid crisis?
It's all connected, right? Like, think about it. Poverty, not having a job, not being able to get mental health care, all of that makes people vulnerable. Like the source says, it creates these cracks in the foundation of communities, and that makes them way more susceptible to this kind of crisis.
So it's like an open wound, right?
Yeah, exactly. You're more likely to get an infection if you have an open wound.
Right. It's not just about the drugs themselves. It's about the conditions that make people vulnerable.
Hmm.
And that brings us to the human cost, which is, just it's devastating. What are we seeing in the real world? What are the consequences of this epidemic?
I mean, we're talking about huge numbers of people dying from overdoses. And a lot of those deaths, they're because of fentanyl. The source, it cites a CDC statistic. Over 100,000 overdose deaths just in 2021. That's more than a whole city. And it's not just the deaths. Families are being torn apart. The healthcare system is completely overloaded. The justice system is overwhelmed. It's really a crisis on every level.
100,000 deaths. I mean, that's almost impossible to even wrap your head around. It's heartbreaking. But the source does talk about solutions.
Mhm.
Amidst all the despair, there's some hope there. So where do we even begin? How do we even start to address a problem this big?
Well, the source talks about a multi-pronged approach, right? So you've got to tackle it from all sides. First, prevention. We need to teach young people about how dangerous these drugs are, help them make good choices.
Education.
Right. And then treatment. We've got to make sure that people who are struggling with addiction can get the help they need. And that includes something called medication-assisted treatment, or MAT.
Okay, MA. The source mentions that as like a really effective treatment. But can you explain a little bit more about what it is, for folks who might not be familiar?
Sure. So MA, it uses medications like methadone or buprenorphine, along with counseling and behavioral therapy. Those medications, they help to manage withdrawal symptoms and cravings, so it's easier for people to actually focus on the therapy and start to rebuild their lives.
So it's not just about like breaking the physical dependence, but also addressing the mental and emotional side of addiction too.
Exactly. It's a holistic approach. The source also emphasizes limiting opioid prescriptions, making sure that naloxone is readily available, and addressing those social and economic issues we were talking about earlier.
You said naloxone. Can you remind me what that is?
Oh, yeah. Naloxone, it's a medication that can reverse an opioid overdose really quickly. It's basically an emergency antidote, and making it available to first responders, even to family members of people who might be at risk, that can save lives.
So all of these solutions, it sounds like it's going to take a really massive coordinated effort. Is there any evidence that this multi-pronged approach, that it's actually, making a difference?
There are some hopeful signs. The source points to a few states that have implemented these measures, and they've actually seen a decrease in overdose deaths. Like, for example, getting naloxone out there, that's been proven to save lives, but, the fight's not over. It's going to take a sustained effort, and we've gotta keep investing in these solutions.
Yeah. It sounds like there's no, like, quick fix.
Yeah,
It's a long road ahead.
it is.
One of the things that really stuck with me from this whole conversation is just the role of those pharmaceutical companies. Like, knowing what we know now, the way they marketed these drugs just seems, I don't know, so irresponsible.
Yeah, I agree. The source makes a strong case that they played a major role in creating this problem, and it raises some really tough questions about corporate responsibility and how much influence these companies should have on our healthcare system.
It's a lot to think about, and it makes me wonder, knowing what we know now, what's our responsibility as individuals? Like, how do we help address this crisis? I mean, it feels so big, but maybe that's the point. It's not somebody else's problem, right? It's all of our problem.
You got it. And this whole crisis, it shows just how connected public health really is. Even doing something small like learning about resources in your community or speaking up, advocating for more access to treatment, that can help. Every bit counts.
Yeah. It's a tough conversation to have, but it's a really important one. So thank you so much for helping us understand this really complex issue.
It's my pleasure.
And for everyone listening, stay informed, stay engaged, and remember, even in the face of something this big, this overwhelming hope and collective action can make a real difference.